The National Health Service, Health and Social Care in Northern Ireland was created separately, and although it does not use the name NHS, it is still often referred to as such, particularly in reference to the overall health system in the UK. The four systems were established in 1948 as part of major social reforms following the Second World War. The founding principles were that services should be comprehensive, universal and free at the point of delivery. A health service based on clinical need, not ability to pay. Each service provides a comprehensive range of health services, free at the point of use for people ordinarily resident in the United Kingdom apart from dental treatment and optical care. In England, NHS patients have to pay prescription charges. Some, such as those aged over 60 and certain state benefit recipients, are exempt. Each of the United Kingdom's health service systems operates independently and is politically accountable to the relevant government. The Scottish Government, Welsh Government, Northern Ireland Executive, and the UK Government, responsible for England's NHS. Since 2013, operational responsibility for the NHS in England has been passed to NHS England. NHS Wales was originally part of the same structure as that of England until powers over the NHS in Wales were first transferred to the Secretary of State for Wales in 1969 and thereafter, in 1999, to the Welsh Assembly as part of Welsh devolution. Some functions may be routinely performed by one health service on behalf of another. For example, Northern Ireland has no high-security psychiatric hospitals and depends on hospitals in Great Britain, routinely at Carstairs Hospital in Scotland for male patients and Rampton Secure Hospital in England for female patients. Similarly, patients in North Wales use specialist facilities in Manchester and Liverpool which are much closer than facilities in Cardiff, and more routine services at the Countess of Chester Hospital. There have been issues about cross-border payments. Taken together, the four national health services in 2015-2016 employed around 1.6 million people with a combined budget of £136.7 billion. In 2014, the total health sector workforce across the United Kingdom was 2,165,043. This broke down into 1,789,586 in England, 198,368 in Scotland, 110,292 in Wales and 66,797 in Northern Ireland. In 2017, there were 691,000 nurses registered in the United Kingdom, down 1,783 from the previous year. However, this is the first time nursing numbers have fallen since 2008. Every 24 hours it sees 1 million patients. And with 1.7 million staff, it is the fifth biggest employer in the world, as well as the largest non-military public organization in the world. Although there has been increasing policy divergence between the four national health services in the United Kingdom, it can be difficult to find evidence of the effect of this on performance since, as Nick Timmins says, some of the key data needed to compare performance, including data on waiting times, is defined and collected differently in the four countries. Statistics released in December 2017 showed that, compared with 2012-2013, the number of patients in Scotland waiting more than 4 hours in accident and emergency dropped by 9%, whereas in England that proportion had increased by 155%. However, since then, Scotland, in common with the other three UK nations, has experienced increasing pressure in accident and emergency departments with lengthening waiting times. When purchasing drugs, the NHS has significant market power that, based on its own assessment of the fair value of the drugs, influences the global price, typically keeping prices lower. Several other countries either copy the United Kingdom's model or directly rely on Britain's assessments for their own decisions on state-financed drug reimbursements. Calls for a unified medical service can be dated back to the Minority Report of the Royal Commission on the Poor Law in 1909. Somerville Hastings, president of the Socialist Medical Association, successfully proposed a resolution at the 1934 Labour Party conference that the party should be committed to the establishment of a state health service, following the 1942 Beveridge Report's recommendation to create comprehensive health and rehabilitation services for prevention and cure of disease. Cross-party consensus emerged on introducing a national health service of some description. Conservative MP and Health Minister Henry Willink later advanced this notion of a national health service in 1944 with his consultative white paper, A National Health Service, which was circulated in full and short versions to colleagues, as well as in newsreel. When Clement Attlee's Labour Party won the 1945 election, he appointed Aneurin Bevan as health minister. Bevan then embarked upon what the official historian of the NHS, Charles Webster, called an audacious campaign to take charge of the form the NHS finally